With the province indicating that there are more new measures potentially coming in the next couple of days, we know that the City of Toronto has been part of those discussions. Health officials here have offered their 2 cents. When asked today what could potentially be coming, they're keeping their cards close to their chests.
They have a very complete understanding, I think, of what we think is necessary for Toronto, and those are the things we think should be done. And if they choose to go in a different direction, we'll have to consider what we can do on our own to try and improve the numbers in Toronto, which are deeply troubling.
At this point, I'm not going to get into the specifics of what we've discussed, but suffice it to say that we've had active discussions with our provincial colleagues and counterparts, and as well active discussions with local public health authorities from all around the province.
One of the 10 city long-term care facilities has been dealing with an outbreak now for more than a month, and despite promises that more would be done to try and help keep things under control, at this point, they're still fighting the battle. The Fudger House long-term care home near Wellesley and Sherbourne houses 250 residents, but COVID has already taken its toll and continues to put everyone at risk. 37 residents currently have the virus, along with 19 active cases among staff. More than 100 have been infected over the last month.
We have worked with Toronto Public Health very closely around the clock. We've been working with hospital partners, IPAC experts. There's active screening 24 hours a day, masking 24 hours a day. All non-essential visits have been canceled, and we've enhanced all of our IPAC practices within the home.
100 long-term care homes in Ontario currently have an outbreak. 25 of those are in Toronto. City staff say part of the issue at Fudger House is asymptomatic transmission, those who have it and may not know it. But it also involves tight hallways and limited infrastructure.
COVID-19 is still finding a way into these settings. This reinforces the pressing need for us to limit our exposure to people we don't live with. Someone, somehow, brought it in, possibly without even knowing it.
COVID-positive residents are being isolated, and enhanced cleaning is taking place in an effort to stop the spread and keep the virus under control. Now, those who have been advocating for more to be done in long-term care might consider this too little, too late. However, the province announced today that staff and support workers that are in long-term care facilities in the orange and red zones of the province will now have to be tested for COVID-19 on a weekly basis.